with age, we're going to get some degeneration of joints, cartilage. One of the hallmarks of healthy aging and maintaining functionality is going to be a continuous push back in the balance of degeneration versus regeneration. Herbs do amazing things. We identified two active ingredients, celery seed extract and boswellia extract. In our clinical trials, we saw a 50-ish% reduction in all of the markers of cartilage degeneration and a 50-ish% increase in cartilage regeneration markers. 90% of the people in the treatment group did not need to come back on rescue medication because we've actually rebuilt their joint. You see it in the radiographs. Their spaces are back, the cartilage is back, they are mobile again.
As we celebrate 10 years of New Frontiers in Functional Medicine and over 2 million listens, I want to say thanks. To help us shape the next decade, I would love your input. Take a quick listener survey. Tell us what you're loving. Tell us what you want to hear more of. It only takes a few minutes, and you'll be entered to win a curated gift basket as our way of saying thank you. Head to the link in the show notes or go to drkarenfitzgerald.com/survey to give us your input. And again, thank you. Hi, everybody. Welcome to a New Frontiers in Functional Medicine, where we are interviewing the best minds in functional medicine. And of course, today is no exception. If you're with me on YouTube, you can see I'm sitting next to the very highly regarded Kiran Krishnan. He is actually a longtime colleague. We met back at CHS in 2021, I believe, Kiran. And I've been an admirer of his career ever since. So let me read his bio to you, and then we will jump into this interesting conversation. Kiran is a research microbiologist and a health and wellness expert who aims to make complex information understandable to all. He has founded a number of successful health companies and supplement companies over the last 20 years, including co-founding and leading Microbiome Labs. I think that's where a lot of us know who you are from. And this is a preeminent microbiome therapeutics focused brand among healthcare professionals. He's currently co-founder and partner in 3 other companies and aims to revolutionize wellness care. Well, you actually have made a really big start and big inroads into that. He's conducted and published several research studies in journals, has published chapters in scientific textbooks and reference books. He's got global patents, and he's a sought-after speaker on human health and the microbiome. Kiran, welcome to New Frontiers.
It's a pleasure to be here. Thank you so much for having me. It's
Yes.
my first time here, so I'm excited.
Awesome. Well, I had such a great time getting to know you way back when, and have kind of paid attention to your career because it's been really quite extraordinary. I mean, you are a revolution. You're a key player in really helping to bring what we're doing in functional medicine forward into the world.
Thank you.
But here you are. We're going to be talking about a Calroy product, a new Calroy product, which I'm quite excited about, Cartilage HP. And, when I was talking to Calroy about doing this podcast with you, and actually about your involvement in the development of this product, I was surprised, because I firmly associate you with microbiome therapeutics. And so just give me a little bit of the backstory on how you became interested in this, and maybe why it's so important.
Yeah. So when I think about the things that really move me in terms of getting excited, interested, devoting a lot of time and effort into. Typically, they're megalomaniacal things, right? So I'm always thinking about really big problems. My interest in getting into the world of the microbiome was to try to solve what I thought were the biggest problems with gut health, and I think most people would agree that one of the biggest problems with gut health was leaky gut, right? So, or endotoxemia, as it's well described in literature. So we founded Microbiome Labs, developed a completely new type of probiotic to address endotoxemia. And in fact, the first paper we ever published was on endotoxemia as a frontier paper in a well-known gastroenterology journal. And so, it's that kind of thinking that kind of led us to looking at solutions for things like osteoarthritis. the connection here is an underlying obsession around chronic low-grade inflammation, right? And when I started really looking into the problem of metabolic endotoxemia, and some of this stemmed from a 2015 publication in Frontiers of Immunology. It was a meta-analysis paper that basically concluded that the number one cause of mortality and morbidity worldwide was stress-induced endotoxemia, right? And that was a little bit mind-boggling to me
Mhm.
because there's lots of things out there that kill people, right? And the fact that these authors, if you will, had the audacity to boil everything down to this one ground zero of health dysfunction, which is the lining of the gut and the resulting pathologies. It became incredibly intriguing to me to really dive into that and understand that process, and at the root of that process is the resulting chronic low grade inflammation, right? And so I became obsessed about this idea of resolving permeability in the gut. And then also understanding where else chronic low grade inflammation plays in the body. And there's lots of places, right? Of course, in the brain, on the skin, and joints, and so on. And one of those areas is in conditions like osteoarthritis. And the reason why I became then really interested in osteoarthritis specifically as a byproduct of chronic low grade inflammation is because the development of osteoarthritis will then parlay itself into much more serious problems, right? Because as your joint degenerates, you're not only then, of course, experiencing pain and inflammation and quality of life disruptions, where then people are taking medications like NSAIDs every single day, or opioids, or any
Sure.
number of pain medications to manage it. They also start to become immobile, and the lack of mobility leads to things like sarcopenia and metabolic syndrome that then lead to a big cascade of much more serious conditions, right? Diabetes, Alzheimer's, heart disease, and so on. And all of that disrupts the microbiome even further. And so, just connecting the dots simply, to
Mhm.
me, it was a matter of, okay, we have a solution for the lining of the gut, and if there's more solutions to the lining of the gut, let's bring it on. Let's do that, right? That stops a big source of chronic low grade inflammation. But then when we look at a foundational issue like joint degeneration, which becomes a stepping stone to more complex chronic conditions, can we resolve that problem? And in a way that actually goes after the root cause and creates change that goes beyond masking the problem, which is what pain medications do. Right. So that's how we got connected with it. And then after I sold Microbiome Labs in 2021, I really started to look at herbal medicine, because I felt like there was a big change that was needed to happen in a lot of herbal medicine verticals. In particular, better identification and better traceability of the herbs, right? And then number two, more original research around what the herbs are, what they do, what the active ingredients are, and so on, right? So that's also another way in which we ended up parlaying into the actives that are found in cartogenics.
That's a really interesting story. Wow. So tackling incredible, just the foundational problems. We could go on about, the issues from joint health origin,
Mhm.
linking to, secondary fallout, significant secondary fallout, and then tying that back into the gut. That's
Well,
really, yeah. Okay.
and sorry, one more thing to interject there.
Hmm.
Another area that I get really passionate about is because I'm such a fan and consummate supporter of functional medicine, holistic health, right? My lifetime career goal is about providing functional medicine, holistic health practitioners with the tools that can use to effectuate health and wellness in their patients, right? Especially where allopathic medicine completely fails, right? And allopathic medicine ends up doing things that are maybe masking the problem or just kicking the can down the road in some way. And then the patients come to holistic health and they don't necessarily have a really great solution yet. That also becomes a big passion of mine. That's in part why Microbiome Labs existed as well, because when I first was looking at the probiotic offerings back then, I felt like there was a significant gap in the
Sure.
therapeutic regimen, right? And where we weren't, probiotic therapeutics were not complete, and dealing with leaky gut was not complete. So in this case, I just put myself in the shoes of a joint health patient, and I've been dealing with degeneration of the joint and pain and discomfort and all that. And I'm at my allopathic doctor, and I'm basically getting recommendations for NSAIDs, and maybe it's going to prescription pain medications. That's not really a solution. My condition is getting worse and worse over time. And then
Yeah.
if I went to a holistic health practitioner, there may be some other things they would try, but they didn't also have a slam dunk product that you can provide me that would alleviate my issue, right? So that's another thing too, is like empowering and providing tools to holistic and functional medicine practitioners.
And that's not to discount, obviously, the power of the gut work,
Hmm.
that you have done some really incredible work around, the power of, transforming the diet and cleaning up nutritional insufficiencies, et cetera, et cetera. So all of that is, I think, an essential
Hmm.
component to this. But I think, you're right, um, around there being some limitations in our therapeutics. And before we talk specifically about, what the product is, I want to just give you a shout out, and also Calroy, and around my gratitude to elevating the conversation in functional medicine. I mean, we've become, at my platform, we really we participate in conversations with those people who are willing to commit their time, their effort, their in financial investment, because research is incredibly expensive, to really identifying the correct ingredients and identifying that they work in humans, at what doses. And it's an exciting time to be in this medicine. It's a really exciting time because there's an elevation that's starting to happen. And so thank you for being a part of raising the bar, because ultimately that serves us, those of us treating,
Yeah.
and our patients.
Absolutely, yeah. And that was the start of Microbiome Labs. It's like, can we create a new standard
Yeah.
for what it means to develop a probiotic product, the level of research you should have, the level of identification and scrutiny on the strains and what their impact is on the microbiome itself. And then all of that goes along with the development of the Cardigenics product and when we talk about the research that we have, it is second to none in terms of joint health support, inflammatory support. And it was such a great fit with Calroy, because Calroy already had a precedence of having very well researched products, very well
Yeah.
understood
A high
products,
bar.
right? So it that really high bar, and there's not a lot of companies that fit that formation. And so it became a really natural fit to partner with Calroy on this.
That's cool. Well, I appreciate all of the backstory, because people are going to want to, are wondering how
Yeah.
you ended up partnering on this product specifically. So that makes a lot of sense. All right, so we want to talk about the ingredients in this product, and then I think you've laid out the problem. This
Mhm.
low grade systemic inflammation that's happening really in all of us. I mean, we can think about inflammation as, just as we age, we're all dealing with some of this. And one of the first places we all see it show up is in painful joints. And, on x-ray, like I had a thumb injury. I crashed recently out in the desert here in Mexico. And, they identified, some mild osteoarthritis, and it's an acute inflammatory condition. But of course, if you take images of any of my joints these days, we're going to see some deterioration occurring, and that's kind of de rigueur, just on the journey of getting older. And with that, I think nobody escapes the fact that there's going to be some discomfort. So we want a product that's going to help with that, that's going to be impactful in the pain. But it seems like there's some cool research actually suggesting that that there may be some reparation happening with cardigenics. It might be turning around. So talk about what it is, how it works, and some of the science on it.
Yeah, and what you said is completely true, right? So with age, we're going to get some degeneration of joints, cartilage, things like that. Same thing that happens in osteoporosis. You're going to be over a net period of time as you age, you're going to be losing bone more so than you can rebuild it. But what one of the hallmarks of healthy aging and maintaining functionality is going to be, a continuous push back in the balance of degeneration versus regeneration, right? And where these conditions really accelerate is when the degeneration far outpaces any capability to regenerate. And that's really the hallmark of aging, right? So if you consider something like the mitochondrial free radical theory of aging, the whole component around the whole mechanism around that is that the mitochondria of cells start to degenerate faster than they can rebuild, and over time what happens is you get a predominance of dysfunctional mitochondria, so the cell doesn't function the way it's supposed to, and as a result the tissue that the cell makes up doesn't function the way it's supposed to. So we want to bring a lot of that back and bring back some balance to it. And so herbs do amazing things, right? As everyone knows who's listening to this. For us, it's a matter of modernizing some of that
Yeah.
understanding, right? And then taking deeper advantage of the amazing chemistry that's within herbs. So we started our investigation in two ways. The first one, so there's two ingredients in cartogenics. One is the celery seed extract, and the other is a boswellia extract. And everybody listening to this has heard of celery seed and heard of boswellia, and they probably use versions of it in practice in one way or the other. But I can assure you these are very, very different. And we'll talk about how we came about a very different way, right? So let me take you back a little bit on the celery. The celery is an interesting story because in a previous company to Microbiome Labs, I had a partnership with a group in India who were working on right now on these ingredients, right? That group in India was originally called Beagle International, and I had a company called New Science Trading. And Procter and Gamble was looking at developing, and this was in 1999, right? And I was a full-grown working adult then, so that ages me to people to understand how long I've been around with this stuff. So in 1999, Procter and Gamble was working on a project to develop a natural anti-pain, anti-inflammatory compound, so a COX and LOX inhibitor. And they were doing it for large breed dogs and animals that suffered a lot of osteoarthritis and arthritic issues, right? Hip dysplasias and so on. And so they started investigating a lot of different herbal compounds. There was some indication that celery seed had some of these functionalities, but the problem is the types of celery seed that are most commonly found, the extracts don't have the right hydrocarbon profile to provide COX and LOX inhibition, because most of them are phthalates, and they will have a 3NB conformation. The 3NB versions tend to be very strong antioxidants and great for neurological health and a number of things, but they don't provide COX and LOX inhibition. So then this research group with Procter and Gamble did a global search of all kinds of different types of celery, and they found that one genus and species of celery that's grown in the northern part of India had the right hydrocarbon profile, where it had the right compounds that could act as a allosteric inhibitor of arachidonic acid, right? So for the practitioners that are listening, if you remember your biochemistry, arachidonic acid is the primary compound that differentiates into lipooxygenase and cyclooxygenase, right? So and so that's where you get all your pain and inflammation signals from. And so anytime you have an allosteric inhibitor of arachidonic acid, you don't differentiate into COX and LOX, and so you can reduce pain and inflammation that way. So they found this unique celery, and then they had to go into process development. So they partnered with an Indian group called Beagle International to develop that product in India. Now, this is a little bit of a tragedy, but fortunately the work continued. But the office in Procter and Gamble that was managing this project was in one of the World Trade Centers.
Oh,
Right.
geez.
So, of course, we all know then what happened in 2001. So that project got shut down within Procter and Gamble. But our group in India had already worked on it for a couple of years and had made significant progress, including doing a number of animal studies showing real significant reduction in pain and inflammation. And so once that was shut down within P&G, our group went to P&G and said, hey, we want to buy out all the intellectual rights on this. P&G said, no problem. We were no longer pursuing this. And so our group in India had it, and I had started working with them back then. So they went on to develop it then as a human product instead of an animal product because of the issue of managing pain and inflammation in a healthy way. And then it became a massive product in India where it became actually a prescription pain medication. And then it became a product in Korea, Australia, most of it under medical foods or even, some prescription level regulatory status. So that is the history of the
Wow.
celery, right? So now since then,
Wow.
we've done a number of studies, more developments, refined it more, did better identification, have better fingerprinting, and so on, an extraction process. The Boswellia is a little bit different. The Boswellia, we actually got hired by a company a number of years ago to look at Boswellia in a different light because Boswellia has about 8 or 9 actives that are very well known. Most of them are in the family of boswellic acids called AKBAs. And those boswellic acids are known to have anti-inflammatory properties, right? So we started investigating Boswellia. We brought in 7, right? 7 analytical chemists who worked on different areas of the project to try to understand what other compounds are present in this amazing plant, right? And so they started pulling it apart, extracting it. They worked on it for about 5 or 6 years, and eventually what we found out is we identified 2 other active ingredients within the same absorption spectrum, and the main one called serotal. That serotal, not only does it also have anti-inflammatory effects like the boswellic acids, but it has tissue repair function, right? So then we said, wow, okay, we have to develop a process to standardize the serotal. And so we developed our own proprietary process to standardize the serotal, standardize the celery seed, create a synergistic combination. And that's where the combination of ingredients came from, right? So combined, it's actually starting in 1999 between the 2 ingredients, probably 35 years worth of work combined into this, right? To create this product that has these 2 synergistic blends that do things that nothing else on the market, natural or prescription, can do in terms of repairing and rescuing joints, right? So it's very exciting to be able to bring this to market.
It's extraordinary, the story that you're unfolding here. It's extraordinary. I did not, of course, know that celery seed had the potential to inhibit COX and LOX to that extent. I of course know about Boswellia, as I think many of us do. It's known for its ability to inhibit LOX activity,
Mm-hmm.
and all of those downstream compounds produced in the arachidonic acid cascade. Those are the first step in any inflammatory pathway,
Yep.
just across the board, whatever flavor, from anaphylaxis to inflammaging. And so obviously, I'm thinking about other indications for this, but
Yep.
I'll put a pin in it. Maybe we can circle back to that later. So I guess, what do I want to ask about? I've got a ton of questions around dosage and duration and degree of inhibition, all of that, but I want, so you asked, I just want to get to the serotal bit, how you figured out it's engaged in tissue regeneration. Did you have a suspicion that such compound would exist, or were you just like, let's explore the other bioactives here and see what they do? And maybe you started with like cell studies and into animal studies, and you began to see that, and any mechanistic information I'd be curious about. And then, I mean, it seems to me also, well, and then let's talk about dosage and, how you identified therapeutic dosage, and I would imagine this works pretty darn quickly as well. So
Mhm.
Question. Let's I start with what I'm throwing out.
Yeah, yeah, and I can give you the overall results from the two clinical trials as well,
Yeah.
which is really quite profound. And then there's a really interesting inadvertent result from the clinical trial that I think is really interesting to speak
Cool.
about. But so one of the things that we've become quite good at is doing something called in silico trials. For anyone who's not familiar with in silico trials, they are really trials in the computer using AI to help you identify potential mechanisms of action based on understanding the compounds, right? And so what we did here, as we and there's two components. There's a serotyl component and another chemical component that's also unique that goes along with serotyl. So there's really two molecules here that are unique. And we what we were able to do with our analytical chemists is be able to discern the full molecular structure and three-dimensional structure of these two molecules, right? So that's step one. Once you understand the full three-dimensional and molecular structure of these compounds, what you can do is if you can put it into an AI and you can ask the AI to search all known receptor sites, pathways and everything that's available in the public domain to see where these types of compounds may function. And what we saw was that the AI had predicted that there may be a function in tissue regeneration, especially in mucosal or connective tissue, and in part by inhibiting degeneration of the tissue, by inhibiting things like matrix metalloproteinases, and then upregulating some transport proteins that bring corrective or reparative compounds back to the tissue, right? And some of these transport proteins, transport channels, and they are proteins as well, can get inhibited by age and inflammation. This is part of why repair becomes really difficult, right? So we said, okay, so there may be a reparative quality to this component of Boswellia. So we now have Boswellia that we know has anti-inflammatory properties because of all the known boswellic acids and all that, but then we may also have reparative qualities. So then the first study we did to figure out if we're actually repairing anything was a gastroprotective study, right? And the reason we did that is because we said that is very relevant to anyone that has joint issues, because people with joint issues have been on NSAIDs and for years, and they have lots of ulcers and degeneration of the gastric mucosa, right? So we said, okay, if this thing can regenerate connective tissue, mucosal tissue, when we use it, we should be able to stop the degeneration of gastric mucosa and reverse it. And there's a very well-known model of studying gastric protectiveness or regeneration. And so we did that study, and what we found was that this was very gastroprotective. So it inhibited the formation of ulcers, and it recovered and reduced ulcer index and ulcer severity compared to the positive control, where you use a compound to induce ulcers in this model. We actually recovered the system better than the positive control that is that is a known recoverer of the gastric ulcer index, right? So right away we're like, oh my God, this thing can actually regenerate tissue. Now, that didn't necessarily mean that we would regenerate tissue in the joint, right? So then we had to go to clinical trials for that. The first clinical trial we did was a very large scale trial, a 1,268 patient trial, right? Nobody in the supplement industry does 1,200 patient trials, right? But we wanted to do it because we had the opportunity to pair with a hospital to get this done, and we really want to see in a population basis, are we going to improve pain and inflammation, right? And improve mobility, reduce WOMAC scores, and WOMAC is the criteria for actually measuring osteoarthritis severity, which looks at pain, stiffness, mobility, and so on. So we said at a population level, if we can reduce pain and inflammation, then we know we have something here, and then we want to go deeper beyond that. So first study completed, I think in 2021 and published, we saw very significant reduction in pain, inflammation, improvement in mobility, improvement in quality of life across the board compared to placebo, right? So that in itself is exciting. Then the next study, we said we want to do the same thing smaller number of people, 60, because we really want to get into the mechanisms of action and we
Yeah.
want to see what's happening with the joint itself, right? So when we want to look at what's happening with the joint itself, there's a few different ways to do that, and we did all of them. The first way is radiographs, right? So we actually did radiological pictures and measurements of the actual joint. Because what you see in osteoarthritis is a loss of that space between the two bones, right? And then you start getting bone on bone rubbing. You can also see synovial fluid inflammation and then soft tissue degeneration. And then the bone that attaches to the cartilage, that bone starts to degrade as well. So you can visualize all that on the radiographs, and then you can measure all that through biomarkers as well. So the exciting result that we got from this study was we repeated all of the WOMAC and the VAS pain scores, right, from the big study that we did. Significant reduction starting at 7 days. You start to see a significant decline in pain, significant decline in inflammation, a significant increase in 6-minute walk test. To me, that's like where the rubber hits the road. That's your ability to walk down the driveway to go get the mail, right? We
Sure.
increase the amount of distance they can cover in a 6-minute walk test by 57%, right? And so we start seeing improvements there. But the two areas that we saw that were really exciting was we saw a 50-ish% reduction in all of the markers of cartilage degeneration. So we're stopping the degeneration. There are well-known markers for this, UCTX and CTX. And then we started to see a 50-ish% increase in cartilage regeneration markers, right? So now we're seeing, biochemical evidence that we are rebuilding the joint beyond stopping the pain and inflammation, right? And then we start looking at the radiographs and we go, wow, you look at the before and after radiographs, no or very little space between the knee joints. And then all of a sudden, boom, it looks like they're 25 years old again, right? The space it has returned. And then where all that really gets memorialized for us is in this part of the study. This is the inadvertent part that I mentioned.
Yeah.
Um, in this part of the study, it was really exciting because any ethical committee, because you're doing study on a population like an osteoarthritis patients, and they're not supposed to be on medication as part of the inclusion criteria. We had to give them rescue medication when they came in for their visits if they complained of too much joint discomfort, right? And the rescue medication was celecoxib, which is a prescription pain med. And so by the end of the 90-day part of the study, 80% of the placebo group, and of course we didn't know this during the study, it was blinded, but after you unblinded it, 80% of the placebo group was back on celecoxib. Most of them, more than half of them, came back on at day 45, right? So halfway through the trial, half of the placebo group was back on prescription pain meds. Only 10%, even at the very end of the trial, on the treatment group was on celecoxib, right? So 90% of the people in the treatment group did not need to come back on rescue medication. And here's the crazy thing. All the rest of the data where we compared WOMAC pain scores and mobility and inflammation and all that, most of the people in the placebo group were on rescue medication at that point, right? So when we unblinded the data and we're comparing treatment to placebo, what we're actually comparing is treatment to prescription pain med. And we still did significantly better than the prescription pain med group, right? And then once the study was ended in 90 days, people stopped whether taking the placebo or the cardiogenics. And then we followed them for another 30 days to day 120. And then up to day 120, just one other person on the treatment group went on celecoxib. So still 87% of the treatment group never went on rescue medication, and 100% of the people in the placebo group by now were back on their medication, right? And the radiographs tell us why this is, right? The radiographs tell us why is it that people did not go back on their rescue medication in the treatment group. It's because we've actually rebuilt their joints. You see it in the radiographs, right? Their spaces are back, the cartilage is back, they are mobile again. They don't have pain. They don't have inflammation. So it's a super exciting thing to see, in a natural product clinical trial, because what we're seeing here is just the amazing power of nature to provide us with these critical compounds that just rebuild our system,
It's
right?
extraordinary.
And it's just extraordinary because it's all here already. We don't have to invent any of it. We just have to be smart enough to look for it in the right places, right? And then test it.
Yeah.
So that's why this particular product really services all of the things that I get most passionate about. And so it's really exciting to be able to bring it to market.
It's tremendously cool. It's extraordinarily badass. I can see, when Andy from Calroy started to talk, I can see why everybody was so jazzed up about it and was really looking forward to us having this conversation. It's extraordinary. By the way, everybody, we will link to those papers, and of course we'll link to Calroy so you can go and learn more about it and check out the products. Hi, everybody. Go to calroy.com/drkf for exclusive resources and discounts on Cardiogenics HP, and check out all the other great Calroy products while you're there. I think fundamental, I was sort of curious when you were talking, if the traditional use history of Boswellia, was there anything known about it being, regenerative? Like, was that in any, you'll be able to walk like a kid again, or was it only thought as pain relief? That's sort of a side. I'm curious if you have any knowledge on that. But yeah,
So
okay.
even in the world of Ayurveda, it's really
Yeah.
known as a anti-inflammatory. There is some recorded history of use for improving bowel function, and that may be some of the gastroprotective side notes that you might get out of it. But generally, it's known as an anti-inflammatory, and I think on the supplement world, it's purely anti-inflammatory because no other Boswellia standardizes it to the serotyl. So you won't find the serotyl component and then the other compound that goes along with serotyl. You won't find those two in any of the other Boswellias in the market. You'll find all the boswellic acids and all that are good anti-inflammatories, but you won't find the serotyl component. So that's where we've kind of accelerated past what is known about Boswellia. And then that's also part of the basis of our global patents that we filed on this, is because we now have a unique identity for Boswellia. We have a unique identity for celery. And what we're showing is that there's a actually unique synergy between the two. There's no competitive mechanisms at all, which is really interesting because even though celery has anti-inflammatory and Boswellia has anti-inflammatory, they both actually come from they approach the anti-inflammatory mechanisms from different pathways, right? So Boswellia does so from the immunological side. So it reduces the overt expression of TNF alpha and all that from dendritic cells and natural killer cells and so on that end up getting involved in the inflammatory cascade. And then we know celery does the arachidonic acid inhibition. So we've got two very different mechanisms that we go after inflammation. And then you brought up a really interesting point, and I love your clinician mind is the other applications for this. At the end of the day, the other thing that really got me excited about this is when you look at the serum inflammatory markers in these individuals, right? All of them are coming down so significantly. We're talking about TNF alpha, IL-6, right? IL-12 beta, IL-1 alpha, like the quintessential markers that are associated with Alzheimer's, heart disease, diabetes, autoimmune conditions, virtually everything. All of those are coming down, right? So there's a
and
global
CTX too. I mean, CTX is crazy. I mean, this is a marker that we routinely order when we're tracking our osteoporosis patients. We have not thought about it with regard to looking at our osteoarthritis patients and whether we're turning things around. So that's really extraordinary that you looked at it for that. And obviously it's another indication potentially for the product.
And one of the reasons why that became so important in the joint space is because that the bone that the cartilage actually attaches to, it starts to degenerate really fast when you get cartilage degeneration. And so you get actually osteoporosis within the joints along with the osteoarthritis. So that's where the osteo component comes from, I think, to a certain degree in the naming of it, because there is bone degeneration as well in that space. And so the CTX became really important. And the fact that we can improve that by 50% is
It's
really
nuts.
amazing,
As
right?
soon
It's
as you said
amazing.
that, numbers flashed by because I do use CTX so
Hmm.
routinely on certain patients, who've got really markedly elevated levels that we need to
Yeah.
work with.
Well, and then
And yeah,
the other one is, matrix metalloproteinases. So
sure. Yes.
MMPs, right?
Yeah.
MMPs are functioning all over the body, doing all
Yes.
kinds of wreaking havoc in many places
Yes.
if they're overly expressed.
Yes.
Right? All kinds of weird remodeling happening in the body, and we brought that down quite
Yeah.
significantly, right? And again, that's at the serum level. We did investigation in some of the synovial fluid, and we see the inflammation, all that going down in the synovial fluid, but
Really?
yeah, but in addition to that, it's the serum stuff that's super exciting to me,
Hmm.
because we're just and then I'm just imagining, like, and I'm a very visual thinker, right? And so I'm always like daydreaming and imagining things in my head. And so then I'm just like imagining the results of this, and with the patient that's now like walking again and having reestablished mobility and improving their metabolic health as a result of that and all that. But then their overall inflammatory picture is going down as they're starting to get up and move and walk and do exercise. And to me, that's just like it's such a wonderful thought to think about being able to do that for 50 million people. It's the statistics show that it's upwards of 53 million adults that suffer from this, and so it's mind-boggling, right?
Yeah.
The core morbidities that go along with it and all that. So I'm very excited that functional medicine practitioners, holistic practitioners, will have a powerful tool to restore these patients with cardiogenics.
Yeah. I'm excited to launch it in practice. Actually, I'm just excited to try it, to be honest with you. What else do I want to say around it? I think the other important thing, just I want to just underline, is that you found the right, like the right species to use, especially for the celery seed. And then with Boswellia, the right elements,
Mhm.
and new bioactives, not really characterized before your research. So that's awesome. And, just figuring out how to dose it. So clearly you lighted upon the therapeutic intervention that's going to work. And and in your study, people stopped it. You still saw benefit.
Mhm.
You said 30 days out, I
30
believe,
days.
right?
Yep. No washout in 30 days. Yep.
And so dosing, you've lighted upon the appropriate dosing, and it's manageable. I'm curious what it is, and
Yep.
then also for these people, I mean, when we're prescribing in practice, is this something that we're going to be using continually? I mean, what about just for prevention? I mean,
Yep.
if I get a total body X-ray, we're going to be seeing some elements of deterioration, as I've already identified in my thumb. And I mean, this seems to be an essential preventative component,
Yeah.
and we're going to be capturing inflammation. I mean, IL-6 is CRP basically. So
Yep.
anyway, there's lots of places we can go with that, but speak to those bits I've just thrown out at you.
Yeah, no, those are really important. So, and we looked at HSCRP too, and that comes down quite a bit, which is great. So the dosing. So we do use some of the in silico modeling to help guide us towards the dose, and based on that, we actually did two dosing studies. So we did one at what is the full dose, which is 1100 milligrams per day, so 550 milligrams BID. So the Cardigenics product it's basically two caps a day, right? So you can take one cap BID. If that's inconvenient, you can actually take them both at the same time, and
Oh, you
that's
can.
fine.
Good.
Yeah, we've done the pharmacokinetics, and it stays active in the blood and serum for most of the 24-hour period. So you're good taking it once a day as well. And then here's what we discovered in the dosing study. So we have a half dose study, which is just 550 milligrams, and we have the 1100 milligrams, right? The 1100 milligrams, of course, provided the most benefit for osteoarthritic joint patients in terms of rebuilding the joint and all that. That's the recommendation for people who have frank joint issues. But for the rest of us that are just aging, we're getting older, we're still active, we're healthy, but things hurt, right? And as we get more active, as we get older, things will hurt even more. And like you said, all of us have some degree of degeneration of joint and soft tissue and so on. And all of us are trying to manage inflammation. And so the half dose study actually showed really potent anti-inflammatory, anti-pain effect and modulation of things like CTX, but at a reduced level than the full dose. So there is a dose dependency. So for someone like me, I'm 48 years old. I'm fairly active. I still, do a lot of things, cycling long distances and things like that. I don't have any, frank joint issues, but I do have pains, aches and pains, and I'm always trying to bring down inflammation. So I take once a day, every day, as protection. And then as
You
I
take
get
550 or are you taking the 1100?
I end up taking 550 most of the time. I've actually gone through, I went through 2 months of taking 1100 milligrams because I started a whole new kind of workout. I started a lot more kettlebell stuff and, swinging
Me
things and
too.
all that,
Yeah, yeah,
right?
yeah.
Yeah. And that stuff can hurt, right?
Yeah,
So,
yeah, yeah.
and my hips and all, like, historically have always been tight and kind of inflamed from all the cycling. I used to be a competitive cyclist, so I spent hours on end on the bike racing, and so I get a lot of tightness around the hips and lower back and stuff. And so when I started doing a lot of the kettlebell work and all that, I went to 1100 milligrams a day, and that helped a tremendous amount, right? And then now I'm gonna, as the season gets on with having more warmer days, I'll start cycling more, so I'm doing less of the really aggressive kettlebelling and all that, so then I'm back on the 550. So my recommendation is, because inflammation is something that we all want to curb, and it's hard to find something that brings down inflammation as much as this product does, that I would say that at least 550 should be a maintenance dose for most people, if you're over the age of 35. And then if you have any sort of joint issues at all, 1100. That's what people should be.
It makes a ton of sense. And you're supporting, you're slowing down deterioration, I think at either dose. But what about pain? So you reported in the study that it was 7 days before there was, just a significant change happening. But mechanistically, it seems to me that probably would experience something sooner. So I'm curious about that, and maybe your own anecdotal experience.
Yeah. So in our empirical look at this, um, most people will feel an effect in the first like 3 days.
Okay.
Now in the studies, it's always 7 because that's always the first visit, right? So the first
Okay.
visit is a week into
Okay.
starting. We don't check with them prior to the first visit, so many of them may have felt improvement in the first 2 or 3 days. But I would say it's noticeable, especially if pain is an issue for you. It's noticeable in three days or so. The part of the reason why it may even take 3 days and it doesn't work like an NSAID, for example, in 12 hours, is because the pain reduction kind of goes along with the inflammatory reduction as well. And we know that it takes the body a little bit of time to simmer down from inflammation, right? Especially when there's an ongoing input for inflammation. And so we're seeing that it takes a little bit of time for the inflammation to go down, and then for the COX inhibition to take effect. And the COX inhibition is different than the COX inhibition with NSAIDs, which
Okay.
also then disrupts the gut, right? So I think it's because of that, because we're going after true root cause pathways that need to be modulated, that mimic healthy function. It takes a few days, but most people will feel something in like the third or fourth day. And then not, and I don't want to skirt over the idea that our first study on this was on gastroprotectiveness, right? So
Right.
think about your patients that have been dealing with H. pylori and reflux and gastritis, right? Any
Yeah.
sort of gastritis, right? They're eating away at the gastric mucosa. We've shown that we can repair the gastric mucosa with this. So even there is another auxiliary benefit.
It's so interesting, extraordinary. I mean, anybody who's taking a nonsteroidal anti-inflammatory is going to be sort of propagating the mechanism that drives the
Hmm.
inflammatory condition they're trying to shut down.
Yep.
And so it's awesome that this does not. It does the exact opposite. Okay, so I've got a handful of questions. Now, clearly, I know folks are thinking, as I am, this was a standalone intervention, so you weren't changing diet, you weren't prescribing collagen, you weren't doing all of the other things that we would be doing in functional medicine. What's your anticipation when, like, they're still doing whatever dietary pattern they came in with, which could have been, who knows, could have been a fast food dietary pattern. They could be undiagnosed celiac consuming gluten, and I mean,
Right.
it could be, right? But with this functional medicine, additional components, like we would want to be using some collagen, or maybe we're boosting protein, et cetera, and helping with
Mhm.
digestion. Like, what are your thoughts? I mean, it seems to me that we could see something powerful in concert with a full functional approach.
Yeah, I think a couple of things. I think number one, the effects that are realized would be realized upwards of 50% faster.
Oh,
And
interesting.
I think that's evident in our empirical evidence, right? So for example, when I've given it to people who are not super health conscious, but they're like, oh, I have a pain thing. What's that joint thing you've been working on? Give it to them.
Right.
They feel right. They feel an improvement 3, 4 days, and they notice it, and then it just gets better and better steadily. But then when it's people I know that are really health conscious and fit and are within our world, their impact is much faster. You know, not to call it Andy, but Andy at Calroy had some faster impact as well, right? She had an issue, I think, on her hand or one of her joints, and I think she felt it within the first couple of days
Oh, wow.
in a much more profound way. So I think everything would get accelerated by 50%. I think the joint repair would get accelerated as well. And I think my hypothesis would be that the dose that we have will actually be utilized much more widely throughout the body, right? So I think you'll start to see um, a bigger impact on more joints throughout the body versus just the bigger joints like the knees and so on, right? And that's the exciting part for me of getting this in the hands of holistic and functional medicine practitioners, and then starting to get the feedback from them because we saw the same thing with Megaspore, right? So with Megaspore, our first endotoxemia study we did was in college students who were not doing anything healthy for themselves during that period, and yet we saw this profound reduction in leaky gut, endotoxemia, inflammation, and so on. And the thing that I was most excited about that is imagine if they were eating right, imagine if they were exercising, imagine if their
Yeah.
stress was being managed right, like
Yeah.
what profound effect it could have. And sure enough, we saw that empirically in the market once we started getting it into the hands of practitioners. So that's where I'm super excited to see over the next 6, 8 months the feedback that practitioners like yourself will give us, because I think we'll probably discover other uses of it
Yeah.
that were not that we couldn't see in our clinical trial because those are generally unhealthy people to begin with.
Right.
I think you guys will find that it affects your patients in an even more profound way.
100%, no doubt about it. So I just wanted to go back to a comment you made when you were outlining the research. You talked about the joint space changes, and I think you just sort of, informally likened the joint spaces to 25-year-olds, post intervention. I mean, have you done analysis where you? I mean, because there is some predictable changes. Like, you could use joint space measurements as a biomarker of aging. I mean, did you actually do that and see that with those changes, or is that something that you might do retrospectively?
So we did joint space measurements in the intervention group compared to the placebo group at from baseline to day 90, right? And then we I don't think we did it at 120 days. So we did baseline to day 90, comparing placebo to treatment group. But what we saw in the improvement in joint space is a would be equivalent to a reversion of aging, right? So that is like an anti-aging. It fits the anti-aging idea. Um, but I think establishing a longer term way of measuring that would be really interesting. And we show in one of the talks that I'll do at some of the shows coming up, we have a number of the radiographs in the
Oh, that'll be
PowerPoint.
cool.
Yeah, so
Yeah,
people can actually see for themselves, like, wow,
yeah,
okay, this is the
yeah,
visual change.
yeah.
You don't even have to do millimeter level, or micron level change measurements. It's so
You see
visually
it.
clear between day 0 and day 90 that it's like
Hmm.
it's mind-boggling.
That's so fascinating. I mean, I would be curious though to compare them to different ages of
Yeah.
normal joint spaces in young adults, middle-aged adults, older adults, etc. That would be super interesting.
Yeah, actually, that's probably data. So if we took all the treatment group people, we know their
Hmm.
ages, right?
Yeah,
And we know where their joint space is now at day
yeah,
90. We could probably compare that to there's
yeah.
probably some
Yeah,
existing data,
yeah, there
right?
is. I'm sure. Well, I mean, I don't know that. Yeah, I'm sure that that you could access some data like that and really get some evidence on,
Yeah.
on
Well,
what's
we could
transpired.
we could give a biological age to their joints, right?
Yeah,
It's like a
exactly,
joint, but
exactly. That's
yeah, which
right.
is really interesting. So your chronological age is this, but your joint is that of a
Yeah,
35-year-old now, right?
yeah,
That could be
yeah.
really interesting. That's a
Super
great
interesting.
idea. That's a
Yeah. Well,
great idea.
if you do it, circle back so we can have a conversation on it,
For
or
sure.
I can
Well,
at least
if
post something.
if we do it, we're going to call it the KF measurement. If
Right,
we're
right,
we're
right.
going to call
I
it the
mean, we do
KF
that with other.
index
Yeah,
of
right,
joint
right,
age, right? Of
right.
biological joint age.
Oh, that's really funny. Yeah, I mean, we do it with VO2 max. I mean,
Mhm.
we're paying a lot of attention to appropriate bioage measures, and this seems like it really could be one. It could be one.
Yeah, that's a
Um,
very interesting idea.
I think I actually have your WhatsApp. I'll periodically bug. I'll put it in my calendar to periodically bug you
Please do. Please do.
because it's
It'll be
something that
great.
you could probably materialize that without too much difficulty.
Yeah.
Okay, contraindications for the product, side effects.
Not so far, no. That's part of the beauty of doing the 1,268 or whatever patient study,
Yeah,
right? That's one of the reasons we wanted to do such a large population is because that's where you really see adverse events.
yeah,
You could get lucky in a 60 patient study and not see any adverse events, but we saw nothing.
cool.
Well tolerated between all these people. These are elderly people and people on medications and things like that. So no known contraindications for it at
And
all.
you know massive use history for both
Yes,
compounds, right?
of
So
course. Yeah.
you've got this data just for millennia, really, basically.
Yeah.
Okay, so let's talk about the other. So Calroy has a pretty cool suite of products. I'm a
Mhm.
massive fan of them. I use Artericell as part of my daily stock, and as it is for a lot of my patients. And I actually have a healthy heart, so I'm sort of using it off label for just general glycocalyx management. I think it's
Yeah.
that important of a player. How do you think about using this with some of the other Calroy products?
Yeah. So actually, that was another reason I became very interested in working with Calroy on it is because as I start to look at overlapping pathologies, and then I start digging into prevalence data and all that. Um, Statistically, it's shown that osteoarthritis patients have a 50% increased risk of heart disease compared to
Mhm.
age-matched cohorts who don't have osteoarthritis, right? And then same thing with cardiovascular patients. Cardiovascular patients have a higher increased risk of developing osteoarthritis compared to age-matched individuals that don't have cardiovascular disease. And what that's telling me is that the pathologies overlap quite a bit because they're both
Yeah,
inflammatory conditions and they're
yeah,
both driven by similar inflammatory pathways. And then also I can really see where osteoarthritis will drive even more heart disease because osteoarthritis also creates sedentariness and metabolic syndrome and all that also elevates that. So
yes,
so to me, arteriocell and cardiogenics go hand in hand, right? And Calroy's done an amazing job of penetrating the marketplace and supporting people who are concerned about cardiovascular health. Those same people, a good percentage of them probably have joint issues as well. And so, as Arteriosol already starts to rescue the cardiovascular system from the foundational issues around risk of atherosclerosis and so on, we can also then start rescuing those people from joint issues and getting them mobile again, getting them moving, which will in turn help their cardiovascular risks also, right? So that significant overlap to me was like a beautiful pairing of the two products going hand in hand, and then every cardiovascular patient could certainly benefit from bringing down all those inflammatory markers, right? So it's a really nice pairing between the two.
It's going to be exciting to kind of see where this goes, as it's launched and as to your point, as more clinician data come forward. I mean, I'm just thinking about the central nervous system and some of the kind of the sexy preclinical work coming out on the endothelial glycocalyx and the blood-brain
Hmm.
barrier and sort of not, or at least the fact that arteriosol could tend to it. I think that the preclinical isn't, we see damage to the endothelial glycocalyx, but it's really exciting that we actually have a meaningful tool. And, of
Yeah,
course, it seems to me like cardiogenics has to have a role, in the central nervous system, and we'll just
for
pay
sure.
attention and see how that kind of, bears out.
I would be very interested to see how this impacts your long haul COVID patients and
Mm,
people with neuroinflammation. I think that's a great area that you're thinking about. And then you throw Vascanox into the mix, like whoa,
yeah.
perfusion for all of us,
Yes,
right?
yes, yes. Right.
And that's just an amazing icing on the cake. And so I take all three products obviously
Yeah.
together, and I think there's going to be some really, really interesting outcomes for patients when you get all three of them on.
Good. Really exciting. Exciting. Let me just ask you, you'd like additional products for collagen, uh, beyond using this one? Like, I mean, are you a fan of using actual collagen, any particular type, anything else? So for what's a good collagen protocol for you? Rebuilding protocol.
Yeah, so for me, so I think taking collagen itself is useful. I think one of the things that one has to really think about in terms of proper utilization of collagen is being mindful of liver health, right? Because if you have, and the prevalence rate of fatty liver and elevated
Yeah.
liver enzymes is just
Massive.
mind-boggling these days,
Yeah.
right? It's a massive epidemic.
Yeah.
And the transporting of collagen and collagen peptides to areas where it needs to go to fix repair like the skin and so on is dependent on the liver in large part. And so I think one of the areas that people really need to be thinking about as we're thinking about rebuilding joints and enhancing the effects of things like cardiogenics, especially if we're taking collagen, is what are we doing to support the liver? Right? Are we doing the milk thistles? Are we bringing down liver enzymes? Are we measuring liver enzymes? Are we looking at fatty liver and so on? So I would say that anything that supports the liver would probably enhance the effect of all of this
Interesting.
quite a bit,
Cool.
because the repackaging of collagen into the types of collagen peptides that our tissue can use is the responsibility of the liver, and the liver has to be functioning properly in order for that to happen appropriately.
That's awesome. That's a really that's a nice angle to put together our thinking around designing a good intervention package. Um, we've covered a ton in this podcast today. I think we've hit all the bases. Is there anything that you want to add? Anything that we missed?
I think one of the things that we've actually, we didn't miss this. We talked about this quite a bit, but I just want to reiterate it.
Yeah.
The inflammatory component of this, right, is just
Mhm.
I cannot say enough about the anti-inflammatory effects of this product. And I've been, and I my personal health focus is around cardiovascular health is my primary. And the reason for that is we have very strong family history, right, of cardiovascular disease. So when I learned about arterial, I got on it immediately
Sure.
3-4 years ago. But then the other thing I'm always watching out for is inflammation.
Mhm.
So I've been taking garlic extracts and turmeric and all of those things, which are all wonderful things, but nothing has shown this level of anti-inflammatory effect as the Cardigenics product. So to me, that becomes one of the real key benefits of this product that shouldn't be overlooked.
Yeah, good. I appreciate that you underline that one again. And we're measuring, we're measuring a good suite of inflammatory markers in clinical practice. Anybody practicing functional medicine is doing that. So data will be, forthcoming from, our various practices, and anybody listening to this, keep us posted, keep me posted.
Yeah.
And then we will also make an effort to share with you what we're learning in our clinical practice as well.
That's excellent. Well, thank you so much. Yeah, it's
Yeah.
been wonderful. I'm super excited for this to come out, and I can't wait to get out there and start talking to clinicians about it.
Yay! I mean, bravo you for bringing it
Thank
forward
you.
to Calroy, Kiran, and just thanks for joining me on New Frontiers today.
My pleasure. Thanks for having me.
As we celebrate 10 years of New Frontiers in Functional Medicine and over 2 million listens, I want to say thanks. To help us shape the next decade, I would love your input. Take a quick listener survey. Tell us what you're loving. Tell us what you want to hear more of. It only takes a few minutes, and you'll be entered to win a curated gift basket as our way of saying thank you. Head to the link in the show notes or go to drkarenfitzgerald.com/survey to give us your input. And again, thank you. Hi, everybody. Go to calroy.com/drkf for exclusive resources and discounts on Cardigenics HP, and check out all the other great Calroy products while you're there. Disclaimer. This podcast is for informational purposes only. If you have a specific medical concern or if you have any questions, please speak with your healthcare provider.